Welcome back to the Nursing Ministry channel, ladies and gentlemen. For the new viewers, my name is Ludia Osita and I am a registered nurse. I set up this platform to help you understand that there's a nurse in each and every one of us and how to use this nursing within us to serve ourselves, to serve our families, and to serve our communities. I would advise you to watch the previous episodes to understand what our discussion is today. For the returning viewers, I thank you so much for returning. And as you join me today, I hope you do the information that I'm dishing out to you so that you would use it to serve your families and serve your communities. So jumping on today's episode, I'd like to first of all start with our Bible story for the day. And by this, I would refer us to the book of Esther. Now, in times past, years and years ago, the Jews had been taken as exiles into a kingdom called the Media and Persian kingdom by a king called Nebuchadnezzar. If you can remember our story last week, I'd mentioned about the wall that Nehemiah was rebuilding and how it was broken down and how the gates had been burnt. Well, it is this king Nebuchadnezzar that had destroyed that wall. And he took the Jews from there, the city of Jerusalem, and brought them to his kingdom. And this is the Medo-Persian kingdom. Now, Nebuchadnezzar had passed on, and so a new king was now reigning, and his name was King Xerxes. Now, King Xerxes had sent his wife packing and had chosen a new wife from the Jewish community, but he did not know that this wife was a Jewish. Now, the wife's name was called Esther. Esther had a cousin called Mordecai who had raised her. And Mordecai was brought into this kingdom by the king Nebuchadnezzar during that exile. So Mordecai had raised Esther because her parents, the father and the mother, they had died. So she was an orphan. And Esther followed all his instructions. So by the time she had been taken to the palace to be groomed, Mordecai had instructed her strictly not to mention her background, her family background, or her nationality, that she was a Jew. Because during that time, the Jews faced a lot of animosity, a lot of hatred from the other nationalities. So Esther obeyed and she did not mention. She became a queen without the king knowing that she was a Jew. Now, during that time, Mordecai worked as a gate man in the palace. And this palace was situated in a city called the Citadel of Susa. And the Citadel of Susa was one amongst 127 provinces. That is how vast the entire Media and Persia kingdom was. So the king's palace was in the Citadel of Susa, and that is where Esther, that is where Mordecai and the king were based, and even the palace itself. So it was more like the administrative center of the entire Media and Persian kingdom. Now, during this time, after Esther has become queen, the king elevated a certain man called Haman to be the second in command. In those days, I would relate it to the vice president of that time. However, Haman was a very evil man. He hated the Jews. And once he was elevated, the king had commanded the officials to be bowing down to him. So anytime he left the palace and was going about, the officials would bow down to him, except one person who was Mordecai, because he was the gate man. So while the other officials bowed down to Haman, Mordecai did not bow down. I believe because he understood that only the Lord God Almighty was worthy of being bowed down to. So he rebelled. So the other officials asked him why. They tried to talk to him. Mordecai did not budge. He refused to bow down. So the other officials reported him to Haman. And once Haman knew about it, he observed it. After investigating, he scorned the idea of just killing Mordecai. He decided he was going to get rid of all the Jews. So he hatched a plan and threw the lot to decide when he would carry out the plan of annihilating all the Jews in the Medo-Persian kingdom. And so after he cast the lot, at that time the lot was called the Pur, P-U-R. He cast the lot, and the lot fell on the 12th month, the 13th day of the 12th month. So having come up with a plan, he went to the king with a story. And he told the king, there are these people in your kingdom. They do not respect your laws. They do their own thing. They are separated. I don't think they are good enough to remain in this kingdom. They're not good enough. They should be gotten rid of. I will put 10,000 talents of silver into the treasury to carry out the exercise to annihilate them. So the king removed his signet ring and gave it to Haman and told him, keep your money. Go ahead and carry the plan. So Haman gathered the royal secretaries and they wrote letters in for all the 127 provinces to all the nationalities and all the people's languages, just to inform them that when it gets to the 12th month, the month of Adar, the 13th day, everyone should pounce on the Jews and destroy them and kill them, then plunder all their properties. So when this news got out to the provinces, everywhere the news got to, there would be mourning by the Jews. They were in distress, they wept, they mourned, they removed their clothes and put on sackcloth, poured ashes on themselves, and just went into lamentation and mourning. So while that was happening in all the provinces, the citadel of Susa was no exception, because the Jews were also there. And amongst them was Mordecai. Now, Esther is out there, inside there in the palace, as the king's wife. And at the gate is the cousin Mordecai wearing sackcloth and ashes. He could not get into the palace because no one wearing sackcloth and having ashes could enter the palace. So, Esther was told Mordecai is wearing sackcloth and has ashes and is at the gate. So this disturbed Esther, and she asked one of the eunuchs to go and find out what is wrong. And she sent him with some clothes for Mordecai to put on and remove what he was wearing. But Mordecai refused to change clothes and told the eunuch, go and tell Esther this is what is happening. Haman has sent letters all around that the Jews should be annihilated and plundered. He'd even put out an offer of 10,000 talents of silver to carry out this exercise. Please tell Esther to go and plead with the king to reverse this edict. So the eunuch took the message back to Esther and told her all that Mordecai had said. But Esther sent the message again back to Mordecai and told him, remember that anyone who approaches the king without being summoned will be killed. And I have not been called by the king for the last 30 days. This is a risk to my life. Mordecai told the eunuch, go and tell Esther. Don't think just because you're in the king's house, in the palace, that you will be spared. Even if you remain silent, help will come for the Jews from any other place, and you and your family will be destroyed. Don't think you'll be spared. So Esther sent message back again through this same eunuch and told Mordecai, fine, tell the Jews in the citadel of Susa to fast. You together with the Jews fast for 3 days. I myself together with my attendants, we are also going to fast. Let us fast for 3 days and 3 nights without eating or drinking. And on the 3rd day, I will approach the king. And if I perish, I perish. If he kills me, he kills me. So Mordecai went ahead and passed the message to the Jews in the citadel of Susa, and they went on into fasting. 3 days, 3 nights, no food, no drink. And Esther did the same. On the 3rd day, Esther put her royal robe and approached the king. When she went to the inner court, the king saw her, but he stretched out the golden scepter, which meant he had accepted Esther. So Esther went in, and the king asked her, Esther, what is it that you want? tell me, even up to half the kingdom, it will be given to you. So Esther requested that the king would join herself, and the king together with Haman would attend the banquet that Esther was going to present to them that day. So the king asked for Haman to show up. They went ahead for the banquet that Esther had prepared. They ate, they drank. Then the king asked Esther, Esther, tell me, what is it that you want? Even up to half the kingdom, I'll give it to you. Then Esther said, if I found favor with you, let the king together with Haman join me tomorrow at a banquet that I will set up, and I'll tell the king what I want. So Haman left and went home, and he went and boasted to his friends and his wife about his vast wealth, about his 10 sons, and even the fact that Esther had set up a banquet and only he and the king did Esther invite. So he said, I'm happy, but the only thing robbing me of my happiness is when I see Mordecai. When I see these Jews, there's something in me that is not happy. I get angry. So the friends and the wife advised him, set up a gallows 50 cubits high and hang this man. Impale this man on this gallows. Then go ahead and enjoy your life. Haman thought it was a good idea. But the same night, when he's building this gallows, the king in the palace cannot sleep. So the king calls out for the chronicles, the records that had been written. And he's being asked for, I know it's a bit weird that he can't sleep. So he asked for the chronicles. You'd think he'd ask for music or a harpist. Anyway, so he asked for the chronicles, and it's brought to him and it's being read out. So a portion of the chronicles ends up being read that there's once upon a time when 2 doorkeepers had planned to assassinate King Xerxes. And Mordecai heard about it, revealed it to Esther. Esther told the king. When it was investigated, it was found to be true. So those 2 doorkeepers were impaled. And so the king's life was spared. And Esther gave credit to Mordecai that it is Mordecai who had found all these things out. And so Mordecai had saved the king's life. Then the king asked the person reading the chronicles, wait a minute. Was there anything done for Mordecai after having saved my life? Then the person reading the chronicles said no. So the king pondered on the matter. He slept. And early in the morning, he asked, who is in the palace? Now, remember, Haman had been given the advice to set up the gallows in order to hang Mordecai on it. So Haman, the eunuch said, Haman has just entered the outer court of the palace. So the king summoned Haman and asked him, Haman, what should be done for the person that the king delights to honor? Haman in his heart thought, whom would the king desire to honor, if not me? So he went on telling the king, well, let the king's horse be brought with the crest on the head of the horse. Then this horse shall be the horse that the king has ever sat on, and a robe be brought that the king has ever worn should be put by a noble on this person. And then, with this person sitting on the horse with the crest on its head, let the noble walk along the city streets proclaiming, this is what should be done to the man that the king delights to honor. So all these things Haman is saying, he was thinking in his mind or in his heart that it is he that the king delights to honor. So the king told him, good, go ahead and do the same for Mordecai. Haman had to do what the kings had ordered. He put the robe on Mordecai, sat him on the horse, took him around the city proclaiming, this is what the king delights to do for the man that the king delights to honor. Then when they returned, Mordecai returned to the gate while Haman went home in grief. He told these things to the wife and the friends. The wife and the friends say, your doom has begun through this Jew. But that evening was the evening that they were to attend the second day of the banquet that Esther had set up. So Haman was whisked away to the palace. At the palace, after having had the banquet, Esther was asked by the king, "What is it that you wanted, Esther? Tell me. Even up to half the kingdom, I will give it to you." So Esther begged the king and said, "Please, spare my life. Spare the life of my family. My people are at risk. They're being destroyed." So the king asked, "Who is the man that would dare do this to you?" And Esther said, "It is this vile man, Haman. He's the one who has planned and even set up that we, my family, the Jews, should be destroyed. We should all be annihilated. If it was a matter of us being sold into slavery, I wouldn't distress the king. But I can't stand seeing my family being destroyed, including myself." Anger came upon the king, and he went out, and Haman knew his fate had been sealed. This meant something not good. So when Esther reclined on the couch, Haman went and kneeled and leaned on Esther, begging for his life. At that point in time, the king came in and found Haman in that state. So he became even more angry. "Does he even intend to molest the queen in my own house?" Before the last word left his mouth, Haman's head had been covered, and another eunuch voiced that Haman had set up a gallows in order to hang Mordecai on it. So the king ordered for Haman to be hanged on that very gallows that he had prepared, to be impaled. There's a difference between impaling and hanging. Impaled is for his body to be pierced through onto the post of that gallows. And so he ordered for the very thing that Haman had planned on Mordecai to be done on himself. And that marked the end of Haman, the end of him. But Esther and Mordecai understood that this wasn't just it. Yes, Mordecai was free from Haman. But remember, there's a letter that had been sent out into the provinces that the Jews were to be annihilated. And in those days, the laws of the Medes and the Persians could never be repealed. Once written, it had to be carried out, especially because it had the seal of the king from the signet ring. So Esther went on the feet of the king and wept and begged him to spare the lives of the people, telling the king that she could not stand to see her own family destroyed, annihilated. So the king told Esther, "I have given you Haman's estate." And Esther took the estate and put it under the care of Mordecai. Then Haman's position was given to Mordecai, and the signet ring was given to Mordecai. In other words, Mordecai took the position that was meant for Haman. And now the king was telling Esther, "I have given Mordecai and yourself the position that Haman could have taken. Do what seems best for the Jews." So they did not waste time. They called the royal secretary quickly, wrote another letter, sent it to all the provinces in all their languages and to the Jews also, to tell them that the Jews have been given permission, that when this day, the 13th day of the 12th month, the month of Adar comes, the Jews have been given the power, the authority to stand up and defend themselves and avenge themselves on anyone that dares touch them or comes against them. So there was joy, there was rejoicing in the city that anywhere that the letters came, they were happy that finally relief had come. So when the day came, because it was months later, when this day came for them to be attacked, some men had the audacity to go against the Jews because they thought they will overpower the Jews. The Jews were fewer in number. However, there were others, like the nobles and the governors and the officials, that supported the Jews and even helped them. But the haters of the Jews pounced on them. But when they did, the Jews are the ones who actually killed them. Now, this happened in all the 127 provinces, including the citadel of Susa. the Jews got the upper hand against the men who came and attacked them. Now, there was the rural part of Media and Persia, and there was the citadel and Susa, which was the urban part. Now, on the 13th day, in the rural areas, 75,000 enemies of the Jews fell in the hands of the Jews. They were killed by the Jews. While in the citadel of Susa, 500 men went down, including the 10 sons of Haman. So the king, when the king got the report about the citadel of Susa, he went and reported to Esther that 500 men have been brought down, including the 10 sons of Haman. What more do you want? Esther asked the king to issue another edict that the following day, in the citadel of Susa in particular, the same activity should be carried out, that the Jews should avenge themselves on their enemies. So on the 14th day of the 12th month, only in the citadel of Susa, the Jews were able to avenge themselves on another 300 enemies of the Jews. So in total, 800. 500 were brought down on the 13th, and 300 were brought down on the 14th. While in the rural areas, in the villages, in the other provinces, the exercise took place only on the 13th day of the 12th month, and 75,000 men were killed. So, ladies and gentlemen, with all this, the Jews had avenged themselves of their enemies, and on the 15th day, whether in the citadel of Susa or on the other, on the 15th day, the Jews in the citadel of Susa were actually rejoicing. They were holding a feast. They had so much joy because they had finished destroying their enemies on the 13th and the 14th of the month of Adar. So in the citadel of Susa, it took 2 days to destroy their enemies, the 13th and the 14th, and the 15th day is when they were rejoicing. They were holding a feast. But in the other provinces, on the 13th day, they brought down their enemies, and the following day, on the 14th day, was their day to rejoice. Why am I insisting on these dates? I will let you know in a little bit. Having done all this, Mordecai, who was in the palace, who was second in command, together with Esther, sat down and wrote another letter. But this letter was mainly for the Jews in these provinces. They were telling the Jews, never ever should you ever forget these events. Should you never forget this day. For generations to come, your descendants, every family, let it be accustomed that this day will be remembered, the 13th day of the 12th month, this month of Adar, and the 14th day. Let it all be remembered that this was the day that the Lord overturned the plan of Haman. That instead of us dying, it was Haman dying. Instead of Mordecai being hanged, it was Haman himself who was hanged on the very gallows that he had set up. Let it be accustomed 1 year after the other, from generation to generation. Let all our descendants never forget this event that has happened. And let celebrations ever be held every year, annually, to celebrate what the Lord has done. And so, it is going to be a time of feasting. There's going to be a food being shared, one from another, and for the poor, gifts being given to the poor. So this was sent out, and all the Jews knew about it, and it is a custom that is being practiced to this very day. Going to Israel in the month of Adar, according to the Jewish calendar, on the 14th and the 15th day are days of rejoicing. There are 2 days because for the people in the villages, they celebrate the 14th. Remember, 13th day is when they avenge themselves on their enemies. So on the 13th day, they avenged themselves and they celebrated the 14th day. But while they were celebrating back in the citadel of Susa, they were on day 2 of avenging themselves. So the citadel of Susa celebrated on the 15th. But today in Israel, both the 14th and the 15th days are days of feasting and rejoicing, and just exchanging of gifts and presenting food one to another. Now, ladies and gentlemen, that takes us back to our topic of today, and that is fundamentals of nursing, otherwise known as the foundation of nursing. Foundation means something on which something else is based upon. For instance, the construction. The foundation is the beginning of that construction. So I wanted you to understand, should you go to Israel or should you hear about the Purim, which is this celebration that takes place amongst the Jews, what does it mean? The foundation of the Purim is this event that I have explained. What happened after what, why, who, how. All this information I have given is what Purim is based on. That is the foundation of Purim. The foundation of these celebrations that the Jewish normally hold, because the Jews are spread out all over the world. You'll find them everywhere, not just in Israel. So in foundation of nursing, it is what the entire nursing course or the entire nursing profession is based upon. That is where we learn the basic things about nursing. So ladies and gentlemen, let's dig in today's topic. Having described what the foundation course is all about, what does this student expect to be taught in this course? Now, one of the things the student will hear is something called the Nightingale's theory. Or rather, let me put it this way. There'll be the history of nursing being brought out for the student to understand where nursing really originated from, especially as a profession. So you'll always hear the name Nightingale. Nightingale was a lady in the times past who now came up with the formal nursing. She's the one who, nursing those days used to be more about being compassionate. Once you have it in your heart to care for somebody, to help them out, to give them medicine until they're strong and they're well. It just used to be a calling. Well, it is still a calling, but Nightingale now put it more structured, that it would be an organized profession, so that maybe in 5 weeks, this person would have to learn what is expected of them, how to do ABCD in nursing before really now being commissioned as a nurse. So in the fundamentals of nursing, this student who has joined the nursing course in the nursing school should expect to learn about the history of nursing, hear about Nightingale, that she set up this formal organized nursing practice in St. Thomas in London. So that is one of the things that the student should expect to learn. A caregiver, that is, bathing and feeding and, helping the person with the activities of daily living. But you're also a communicator. You're also a manager for the patient, meaning you will be the one responsible to coordinate care for this patient. You're the one who will be responsible to communicate with the physical therapist, communicate with the nutritionist, communicate with the healthcare provider, the doctor, coordinate all this for your own patient. So you're being taught that you're also not just a caregiver, performing these activities for the patient, but also a manager coordinating all these efforts for the sake of your patient. You as a nurse, you're also an advocate for the patient, meaning your main concern is the patient. For example, should the doctor prescribe a medication that your patient is allergic to? The physician may not quite remember that part about allergy, but because you're the advocate, it is your responsibility to remind the physician that the patient is allergic to 1, 2, 3. Could you please prescribe another medication? So you are an advocate for the patient. Other than that, also expect to learn about nursing theories. I'll help you understand why it's important. There are various theories. We have the Sigmund theory. We have the Kohlberg's moral developmental theory. Now, these theories touch on various areas, some psychological, some physical, some the moral development, but they help the nurse understand what is expected at each age gap. So in each of these theories, there are age gaps that helps you understand what you should expect at that age gap. For instance, one of the theories may aim at the physical, that at this age gap, expect to see this kind of behavior. So that when the nurse sees maybe a person that is not in that age gap, they are in a higher age gap, they should not expect them to behave in that manner, and so they will know they have deviated from the norm. So the theories are being taught for the purpose of the nurse understanding the behaviors and what to expect in a particular age group, from the infancy to the toddlers to the younger adults, all the way to the older adults. That way, the patient will cooperate and eat their meal. Other than that, there'll be a clash, and this will impact the client, of course, nutrition-wise. Another dietary factor are the Islamic community. Now, the Islamic community do not just eat any meat brought into them. The meat has to be a halal, meaning that animal was prayed over before it was slaughtered. And not just by anyone, mostly it is by their own Islamic brothers and sisters. So the meat served to them has to be halal meat. Either the dietary department, when they are serving the meal, they should indicate that that meal is halal, or allow them to have their own food come from home because their meat is halal. Another thing, the Seventh-day Adventists are vegetarians. So again, you cannot serve them a meal with meat whilst they eat vegetarian diet. So you'll expect that when the tray comes in, it should have vegetarian food or even gluten. Gluten is a form of diet that looks like meat. It looks like meat, but it is made up of wheat and all that. So it is vegetarian, but it has the appearance of meat, or any other diet that they would prefer that substitutes their meat. For the Seventh-day Adventist, the Hindus do not take beef because for them the cows are sacred. So you cannot serve the Hindus meat. You'd either have to serve them lamb, chicken, or any other meat as protein instead of the beef. So these are cultural things that they practice. Another thing that is not dietary is how they relate to others. For instance, the Hispanic, they value the older generation so much that even decision making is made by the patriarchs and the matriarchs in the family. In that the grandfather can decide what should happen to the grandchild by overruling the parents. I hope you've understood me. The grandparents, the great-grandparents or the grandparent, the older patriarch or matriarch decides on the family matters. So how does this affect this patient who is in hospital? Should they come to the hospital in the hospital room, or when the nurse is caring for this patient and the nurse is asking the patient information, and you realize that this Hispanic lady or woman is not responding, instead they are looking up to the patriarch who is in the room, and then the patriarch answers the questions that the nurse is asking the patient. So they probably are asking, are you ready for the surgery? and they realize that the patriarch is the one answering instead of this patient, the nurse should not get angry and say, let the patient answer for themselves. Because according to their culture, the decision making is done by the patriarch themselves. Or in some communities, it is the male figure, the male gender, that is the one who is a decision maker. So the person that is sick, the child that is sick, the woman, or the decision making, their own healthcare decision making is done by the male in the family, whether it is the brothers or the husband or their grandfather. They are the ones to make the decision. For instance, whether to go ahead with a certain surgery or not, whether or not they are ready for discharge, or they should wait a little bit until they are well. So it is not for the patient to decide. The nurse has to understand all these cultural implications so that when they are caring for the patient, they should understand who is making the decision for this patient. Now, this goes on even in death and grieving, because some, like the Islamic community, when the patient dies, the nurse should not go ahead and start cleaning the body and stuffing cotton wool and wrapping and sending the body to the morgue. They have desecrated that dead body, because according to the Islamic community, the gender of the person that has died, if it is the male, if the person who has died is a man, it is the male who come, they have their own prayers, they do their own cleaning, then with a white linen wrap the body, and they take the body for burial within 24 hours if possible. So the nurse should understand, so that they don't desecrate and do all this, send the body for autopsy or post-mortem. By the time the family gets there, the body has been done post-mortem, it's in the mortuary. They would have done something wrong, even though the patient has died. They have offended the family, and that sends the whole matter into a different trajectory. So they should never do that. And that is why in fundamentals of nursing, this culture is communicated, the cultural differences is communicated to the nurse so that they are aware. Now you may say, but there are so many different cultures all over the world. Well, they try to compile them, to put them in groups, like the Hispanic community, the African Americans, the white Americans, the Asians, the Buddhists, the Africans. So all this will try to give an understanding how different people do their own things culturally. That the Chinese, whenever you speak to a Chinese, or the Asians, when they say Asians, you put Chinese in that bracket, that the fact that they keep nodding their head does not mean that they are agreeing with you, the nurse. You could be giving instructions and the Chinese is doing this. You could be saying something and they keep on doing this. That does not mean they have agreed with what you're saying. That is just their way. For them, saying no is disrespectful. But it does not mean they have agreed with what we're saying. That is why most of the time, when you talk to them, they keep doing this. So when all this is communicated to the nurse, when they have a Chinese patient or a Chinese family, they already know that I'm giving this information, but it doesn't mean they have agreed with me. So I will ask them to let me know, to revert back and probably put in writing what they have agreed with, what they have not agreed with, and that is what they will go by. Because it will tell you whether they've understood or not understood, what you need to repeat or not repeat, what they are consenting to or not consenting to. Ladies and gentlemen, let's move on to our next topic, because culture is quite vast, and that is developmental theories. Now, this one really, I'm referring back to what I've just mentioned, that we have different Sigmund theory, Erik Erikson theory, we have the Kohlberg's moral developmental theory, and on and on. And it's just to help understand what happens in each stage of life. Now, our students, our first-year student in nursing school, should also expect to be taught about conception, matters from conception to the older adult. Now, they are going to learn everything or the changes or various factors, in each of these different stages of life, from conception to the newborn, to the toddler, or rather infant, to the toddler, to the preschooler, to the school-age child, pre-adolescent, adolescent, young adult, and older adult. These are the various stages that everyone goes through to the very end, that is, if death does not cut us short in between. So the nurse who is in their first semester is being taught, this is what you are to expect with a newborn, for instance, or even conception. These are the changes that happen intrauterine. Then once they are born as an infant or a newborn, this is what you should expect. That when, for instance, on the sole of the foot, when you do this to a child, they should be able to fan their toes. We call that Babinski reflex. And it tells you that their nerves are okay. But if you do this to now an adult and you do this to their foot, maybe their foot is relaxed like this, and you stroke the foot from the heel upwards, and an adult does this, something is wrong in their nervous system. Remember anatomy and physiology. They should not fan their foot. So try it on yourself or on someone who is next to you. Let them lie down and put their foot like this. Then stroke. Should they do this and fan their toes, neurologically, it is abnormal. They should try and do this. Like if you've gone for a pedicure and they work on your foot, more than likely you will pull away. That is the normal reaction for an adult. But for a baby, they should not do this. This is abnormal. They should do this. They should display that Babinski reflex. And that is the normal. Now, in fundamentals of nursing, such kind of things are taught. The physical changes also. That in, for instance, an infant or a toddler, in their physical changes, they are able to stand at 1 year. They should be able to stand. At these few months, they should be able to roll. At a certain stage in their growth, they should be able to sit. So these developmental changes are taught in fundamentals of nursing for the nurse to know the normal, which makes me pause. I understand that for the bankers, the tellers in a bank, part of their training is that they are being told to identify a normal currency, the note or the coins. They should be able to tell what the normal feels like. They're not taught about the abnormal yet. In their main basic training, they're taught how a normal note feels like. Maybe when they're counting, as they count, they'll know this one is normal. This one is normal, 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 normal. So that the day they will touch an abnormal note, they will know and put it aside that this one is a counterfeit note. Same with nursing. We are being taught in fundamentals of nursing the normals of each stage of growth. So that when we encounter an abnormal growth pattern, we are able to pick it out. Not so that we can discriminate, but so that we can nurse them in a manner that will help them in that stage that they are in. Let me point out something. A nurse who now takes care of a teenager should expect certain body changes. Already when they receive the teenager, they will not take them and nurse them with the older adults. These are different age gaps. They nurse them with fellow teenagers or pediatrics, because pediatrics is from a certain age to 18 years. So they nurse them together. Why? Because not only are there physical changes, there are also psychosocial changes. It is in this age group where they want to interact with each other. So if they are, whatever they're suffering from is not infectious, they have to be put in a setting whereby they'll be able to interact as they get well. Unlike the adult who is not into this psychosocial interaction, where they get to choose whether they want to interact and when they want to interact. So those kind of psychosocial changes are also communicated in fundamentals of nursing in order to understand these different groups and what are the needs of these different groups and what are the body changes also. Now, moving on, having touched on these different age groups, we have the nursing process must be taught in fundamental of nursing. Now, the nursing process really encompasses assessment, diagnosis, planning, implementation, and evaluation. Assessment, diagnosis, planning, implementation, and evaluation. We call it ADPI. Now, what this refers to, the student nurse is being taught how to assess the patient who has been brought into the healthcare facility. They are assessing for various things which you're going to talk about, and then how to plan for their care. How to diagnose them as a nurse. Remember, the doctor has diagnosed that they have a certain disease or they have a certain injury. That is medical diagnosis. Now, with this diagnosis, this is nursing diagnosis, but it is related to what the doctor has already diagnosed. Then how to plan for the care based on this diagnosis, how to go about implementing whatever they have planned, and then how to evaluate whether their plans that they are implementing are really they are meeting their goals. Are they meeting the goals that they had planned and implemented? Now, one example is, for instance, that the nurse has assessed that this patient is dehydrated. Why are they dehydrated? It is related to the medical diagnosis that they got burnt. So they have dehydration related to that the burns that they suffered that the doctor has already diagnosed. So what should we assessment? They've assessed that they have burns on them. Then they have put a diagnosis that they had dehydrated. How did they know they were dehydrated? There are certain parameters they look at. For instance, the mucous membranes they've turned white. What other thing? The skin turgor. When they pinch the skin, it takes a while before it goes back to normal. So there are certain things that we look at to tell. Even their urinary output is reduced. So they understand this patient is dehydrated. That is the diagnosis they've come up with. So they end up planning. The plan is that every hour, I'm going to be giving this patient to drink 100 milliliters of fluid, whether water or juice or soup. 100 milliliters every hour, a little bit, because I want to replace the fluid and the electrolytes in their body. That is a plan. Another plan is, that is one of the plans. And then I'm going to also measure their urine output, because you have to tell, is it increasing? If the urine increases, then that tells you that yes, they're able to take in and absorb the fluid. That is why it is coming out as a urine output. So they plan these things that we're going to be measuring the urine output maybe every 4 hours. Then I'm going to give them something to drink, 100 milliliters every 1 hour. That is the plan. But the plan has to be implemented. It has to be done. So the implementation means that the goal is that after the implementation is actually doing it. So they'll be documenting, yes, it was done at 7 a.m. They drank 100 mils. At 8 a.m., another 100 mils of juice. Being specific, we'll talk about documentation very soon. So after implementing, evaluating. You're evaluating, has the goal been met? Because during planning, maybe you said that every 1 hour, the goal was that after a certain time, the skin tagger should have returned to normal, or the mucous membranes, the capillary refill. There are various things that you will look at. Your goal was that after a certain time, you should have achieved something. So you're evaluating whether the goal was met. So all this, called the nursing process, is also taught in fundamentals of nursing or foundations of nursing. So moving on, we see matters communication. The nurse is taught how to communicate verbally and non-verbally, how to communicate therapeutically. So all this is being taught, that we have verbal communication and non-verbal, and that it is not enough to just verbalize or talk to the patient or their families or even other care providers around. That there is a way you communicate as a nurse that is correct, that is therapeutic also. So there's a difference between saying yes. There's a difference between saying yes. You see, there is this nonverbal communication. You're shrugging your shoulder, you're vibrating as you say yes, and there's also one that is say yes. Those are taught in nursing school, so that the students should understand when you're communicating out there, don't just think it is the words that matter. Your body language matters, and it depends on how the patient will relate to you, will even trust you, will open up to you in releasing information and in cooperating in their care. There's also a difference between asking a patient. For instance, they've come in with poisoning, they took poison to commit suicide. So the nurse can ask the patient, why did you take the poison? The patient may not say anything else other from that point on. They will shut off. Because you as a nurse have come so forthright, you've shut off the doors of communication by asking them, why did you take that poison? Versus asking the patient, is there anything you took that could have possibly harmed you? This is an open-ended question that opens the patient to even communicate more and say yes. They may end up just saying yes. It is upon the nurse to keep probing in a manner that allows them to open up and open up and open up some more. And eventually, they will tell you, I took petrol. That is communication, therapeutic communication, verbal and nonverbal communication. All that is involved in fundamentals of nursing. Quickly, ladies and gentlemen, because I seem I've really stretched us, I'd like to also touch on documentation. The nurse is taught on documentation, how to write their nurses' notes, how to put down things that the notes they write should be factual, it should be accurate, it should be factual, it should be accurate, it should be organized. By this I mean this. They should not write what they think happened. Factual means it actually happened. For instance, they should not say, the patient refused to have their breakfast. I think the patient is angry. That is not factual. That is your thought. They should write, patient declined breakfast, 20%. Nothing else that did not, what they should not put in their thoughts into it. It is about facts that they declined to eat breakfast and all they ate was 20%. Something of the sort. Then it should be accurate, of course. Accurate is, for instance, they have assessed a wound. Remember our nursing process, assessment, diagnosis, planning and all. So they have assessed a wound. They should not document wound is very large on the right arm. It should be accurate. The wound is 8 centimeters wide, 4 centimeters in width, 2 centimeters in depth, located on the upper right upper right extremity. This is an extremity. This is the upper part, and this is the right side. So the right upper extremity. That gives an idea where that wound is located, how the wound looks like. They should go further to document. Does it have a pus? We call it exudate. Does it have gangrene? Is it reddened? All that. Is it smelling? So the documentation should be accurate. It should be factual. It should be organized. Don't jump from, they should not document jumping from their nutrition to their elimination to their assessment. They're documenting things up and about. No way. And another thing, the information should also be current. Meaning they should not document and say, yesterday, the patient had refused. No, it should be what is happening. It should be current time, because they have to set the date and the time they are documenting. And there's a way they document, should they have missed an information within the past few hours or so. Otherwise, that information should be current based. Not 2 weeks ago, the patient had. No. So all this, again, is taught the nurse so that they will know how to put down their documentation. As I close up, I'd like to also put in a very important part. Probably this is what I should have started with as the nursing fundamentals. But in this course, the students will be taught about the hygiene of the patient, about oxygenation, about elimination, both bowel and urinary elimination. I'll explain in a minute. They'll be taught about the comfort of the patient. Now, what I mean by this, hygiene, how to bathe the patient, how to bathe the patient, how to do mouth care. We call it oral care. You know, how to maintain the cleanliness of the patient and the patient's environment. All this, they are taught in nursing fundamentals. And even the practical part, because it's fundamentals, they are going to go now to the clinical areas. But the clinical part, now they're learning in the simulation lab, with the mannequins, with the dummies. So they have this mannequin and they're taught how to clean the eyes. They're taught how to do the ear care, how to do the mouth care, how to brush the teeth of the patient. How to, if they have the dentures, you know, the fake teeth, how to remove them, brush them, and soak them overnight. And then in the morning, put them in, do oral care before putting them in, and, you know, before presenting food for the patient. How to do the hygiene, to bathe the patient, you know, how to bathe them in bed and how to shower them inside the bathroom. All this is taught. And even the techniques, there are certain techniques to ensure that the patient does not shiver with cold. Maybe if you're doing their bath on the bed, you don't expose them, and then just bathe them from the toes to the arm, move to the head, turn their backs. No, there is a certain procedure from clean to dirty. You wash them from the clean part to the dirty part of the body, from outside to within. There's a way you cover the patient so that only the part you're cleaning is exposed. You dry that part, cover that part, expose another part, clean it up, dry it, cover, moving on from on the body until the entire area is cleaned. This way, the patient is not exposed in an undignified manner. They're also not exposed to the draft where they get to be cold. You know, the dignity is maintained and the warmth of the patient is also maintained. And with this, the hygiene is also achieved. Then nutrition-wise, how to feed the patient orally. There are certain foods that other patients cannot eat, maybe because they don't have teeth or they cannot swallow well, so they need food that has been pureed. Then also, feeding is not just oral. There are some patients who cannot eat through their mouth, so they have tubes through their nose, they have tubes through their stomach, they have tubes, there is, what do you call it? I don't want to call it injection. There is how do I explain it? There is a tube, a small tube going directly into the heart, through the blood vessels rather, all the way to the heart. So it brings in food that comes in, it looks like milk, and it is channeled to the heart. So there are various modes of giving nutrition to the patient that this nurse in fundamentals of nursing is taught about. Even how to regulate the feeding so that they don't just dump the food into the stomach. There's a way they put in a little at a time because it is going directly into the stomach. There's a way that feeding should be warm so that they don't get it directly from the clinic, from the refrigerator in the medication room and come and pour it when it's cold into the stomach. It has to be warmed and coming in with warm water into the stomach. Elimination, likewise, we have catheters. Catheters are like rubber tubes that go straight maybe into the bladder to drain of urine for the patients who cannot who cannot eliminate urine voluntarily. So then we have wound care for those who have ulcers, maybe because of being incontinent or because of lying in one position for a long time, they've developed a wound. How to ensure that wound is clean, how to change the dressings of the wound. All these are taught in nursing fundamentals. Oxygenation, the oxygen given, how to regulate the flow rate. Of course, it depends with their care, with their diagnosis and how the doctor has prescribed it. But it is the basic knowledge of these various modes of delivering oxygen or even measuring oxygen. How to take the vital signs, the pulse, how fast the heart is beating, the temperature of the body. There are various areas that the temperatures can be measured. From the thermometer can be put in the mouth, it can be put on the armpit, it can be put anally. So there are various areas the temperatures can be measured. Some probes you aim the probe on the forehead or on the temporal part and it measures, the digital ones, it measures the temperature. So all these ones taught to the student, they're able to learn and know how to do them so that by the time after they've practiced with the dummies or the mannequins and they end up going to the hospital setting, they are confident to do these things, and every time they keep doing it over and over again, it just becomes second nature to them. Ladies and gentlemen, I think I'll stop here. We've taken an hour. I didn't intend for us to go this far or this long, but it had to be since our Bible story had to be incorporated. I'll stop here, but this is not all that nursing fundamentals is all about. I wanted to just give a general overview so that you who is interested in joining nursing, you have an understanding that you'll be taught from the history of nursing all the way to the nursing daily practices, oxygenation, bowel elimination, nutrition, comfort of the patient. All these things will be taught to you in nursing fundamentals. So you don't have to be anxious about, so when will I learn this? Will I be going to the ward and yet I don't know how to bathe a patient? You'll be taught everything. How to change the bed linens. You'll be taught everything in nursing fundamentals, and you'll get to practice these things with a dummy, and then there'll be a skills check. The instructor will watch you do these things, and that will be a test. Once you pass, then you'll be released to go to the wards. And believe you me, as you do it, and you do it with the patients over and over again, it becomes second nature. So that will not even be the main thing about nursing. You'll have graduated into handling other things like the medication, the procedures that the doctors do, how to work with them, because already this will be second nature. No matter where you'll be practicing nursing, whether in the home, whether in the clinic, whether in the hospital setting, these skills will be applicable. You won't have second thoughts about it. It will just be second nature that you'll see a patient who has soiled themselves. Immediately you'll put on your gloves, you know how to position them, you know how to move them about, you know how to clean them up, to shower them, to dress them, and to sit them back. It will just be second nature without thinking twice. And the beautiful thing about this is that now you're able to incorporate the communication skills you've learned with these skills of basic skills that you're performing, so that you're not doing the cleaning and your communication is coming out wrong. You're able to therapeutically communicate as you do it, and by this, you're delivering total nursing care in a perfect way, in a way that truly ensures that this patient is restored physically, mentally, emotionally, and even spiritually. I realize that I haven't spoken so much about the spiritual aspect, but I want to bring it up in a different episode because it is a sensitive area that really should be incorporated into nursing, but there is a way to do it so that you ensure that the patient does not go off while you're thinking you're doing the right thing, imposing your own spiritual practices on the patient. Instead of helping the patient, you rob them of that capacity to even heal faster or even become whole. I will leave you at that point. All I can say is thank you. Thank you, and thank you again for stretching out with me up until this moment in time. I hope you've learned something. Use the little you have learned to encourage somebody to come and practice nursing as a profession. And if not, use the information you have learned to inspire you to get more information online or even in the books at the library. Learn more about these things that I've pointed out. Go and get the book on fundamentals of nursing. Try and have an idea what bathing a patient is all about, feeding a patient is all about. Become that nurse, serve yourself, and again, I'll talk about serving ourselves in this nursing journey, but also go and serve your families and the community using whatever information you get. Once again, my name is Ludia Osita, and I thank you for joining me in today's episode. Until next time, have a beautiful day. Goodbye.